The EndoVent pulmonary catheter is a multifunctional device that is positioned in the main pulmonary artery to monitor pulmonary artery pressure, remove blood from the pulmonary artery, as well as assist in decompressing the heart during cardiopulmonary bypass. This non-heparin-coated 8.3 French device is pre-shaped and flexible to facilitate percutaneous placement through the right internal jugular vein or the left subclavian vein. The catheter has two stopcocks to allow access to the two lumens. The two-way stopcock is attached to the balloon inflation and deflation lumen. The three-way stopcock has attachments on each of the two ports. A hose barb adapter is attached to the end port to enable the connection of the pulmonary artery venting line. A pressure line is attached to the side port to allow for the monitoring of pulmonary artery pressure. The device is protected by a contamination guard, which will protect the catheter shaft and be positioned when the clinician attaches it to the introducer. The markings on the catheter are intended to assist with catheter placement by informing the clinician the depth of catheter insertion. The integrated balloon, near the device's distal tip, is designed to flow direct the catheter into the pulmonary artery. Other contents that are included in the packaging are a 1.5 milliliter syringe for inflating and deflating the balloon, and a 9 French introducer kit, which is compatible with the device's contamination guard. Upon removal from the box, visually examine the sterile packaging for evidence of damage. If any damage is observed, do not use the device. Remove the EndoVent catheter and all components from the package and place on the sterile prep table. Visually inspect all the components for damage. If there are any signs of damage, do not use the device. Tighten the pre-assembled lure connections. To prep this device, perform the following steps. First, the balloon inflation lumen, which is attached to the two-way stopcock, is prepped. Remove the white cap from the two-way stopcock. Also, remove the cap from the 1.5 milliliter syringe. Fill the syringe with air or carbon dioxide. Bacteria-filtered carbon dioxide should be used to inflate the balloon in any situation where balloon rupture may result in an air embolism in the arterial circulation, such as any patient who may have right-to-left intracardiac or intrapulmonary shunts. It is important to remember that the EndoVent balloon is never inflated with liquid, as this is a flow direction catheter that requires air or carbon dioxide in the balloon to function properly. Attach the filled syringe to the two-way stopcock. Verify that the two-way stopcock is open to the catheter. Depress the syringe plunger to fill the balloon with air. Verify the balloon's integrity. Once the balloon's integrity is confirmed, draw back the syringe plunger. Remove and de-air the syringe. Reattach the empty syringe to the two-way stopcock. Draw back on the syringe plunger to ensure all air has been evacuated and the balloon is fully deflated. While the syringe plunger is retracted, turn the two-way stopcock off to the catheter, thus creating a vacuum in the balloon. This step is important to ensure the tip of the catheter passes smoothly through the introducer sheath. Remove the syringe and fill it with air or carbon dioxide. Reattach the filled syringe to the two-way stopcock. The balloon and lumen are now primed. Next, the pulmonary artery venting and pressure monitoring lumen, which is attached to the three-way stopcock, is prepped. To prep this lumen, first turn the three-way stopcock off to the catheter. Remove the contamination cap on the hose barb adapter. Fill and de-air a syringe with sterile physiologic solution. Attach the filled syringe to the end of the pressure line. Flush sterile physiologic solution through the pressure line until fluid flows out the end of the hose barb. Turn the white three-way stopcock off to the hose barb adapter. Recap the hose barb. Flush sterile physiologic solution through the device until a continuous stream flows out the tip of the catheter and all air is displaced from the lumen. Turn the three-way stopcock off to all 3 ports by positioning it at a 45-degree angle directly in between the hose barb port and the pressure line port. Disconnect the syringe and then wet fill and cap the pressure line. The EndoVent pulmonary catheter is now prepped and ready for use.